And I'm delighted to have Dr. Shabazz with us here on Pivotal Moment. We are going to get some wonderful information and definitely a lot of inspiration from this pioneer who is changing Chicago one patient at a time. Dr. Shabazz, welcome.
Thank you. Thank you for inviting me.
Oh, I am so impressed with what you're doing. It was a delight to be able to come to the center and see you and so many folks who would come out to support you. Tell us a little bit about your vision for the center, how it came about, and what you were thinking when you envisioned this.
Well, actually, I was like most people in the country and in the world, I was hunkered down at home. I was in Texas, actually. I have a home outside of Austin, Texas. And, I was actually, as they say, chilling in a way. But, as the weeks went on, we realized that this pandemic, and of course, this is back in 2020, we realized this pandemic was something more than, just a short-term global disease. We found that there were some suspicious areas of information that we weren't getting. Okay, and primarily who was primarily being affected by this. And being Black in America, with so many catastrophes that African Americans have experienced over centuries, we're typically the ones who get hit the hardest, especially when it comes to something that has to do with health and wellness and housing or anything that we're unstable with, education. So I started reaching out to people I knew in the industry, and I said, hey, is anything coming across your feed as to who is being affected by this pandemic? Because all I was hearing was something year old male, and they had an underlying condition. But I said, wait a minute. And so we knew right then and there that something was amiss. And so when I started finding out what the data, and as we found out, as the weeks went by, that more and more African Americans, people of African descent, were being affected by this, and it was primarily Black and brown, almost neck and neck with each other. So I have a strong background in community health. I've been working with community health centers for over 40 years now. I love the program because it does not deny people care based on their income. And so I've been able to travel all over the country as a consultant for the federal government, seeing many health centers who started out of just a desire from communities to have adequate health care. And so I said, knowing I had this experience and seeing what was happening in Chicago, which at that time we ran across information saying that in the South Shore community, which is on the southeast side of Chicago, that there were more infections and deaths in the entire state of Illinois. And also it's where a nursing home that when I saw the name, it was a nursing home that both my mom and and a cousin had resided in 10 years before, that this was a nursing home that had the second highest number of deaths among her nursing home patients within the entire state. So it really hit home close to me. And knowing that even though this community health center program has been around a long time, and there are quite a few of those centers in the Chicago area, it just still was not enough. And so that's where I just started talking to people and said, we need to do something. Say that we have an excuse because so many of us have been in healthcare. We work for health departments, we work for hospitals, we work for health centers and doctors' practices. We in practice ourselves, and yet we still felt as if we didn't have enough, Yeah. So I pushed back against that and started, talking too much, and when people would say, yeah, we need to do something, whatever that happens, that puts the onus on you to get it. So we were very fortunate that at the same time, my godson, who was a business owner, when he told me he was acquiring a building next to one of his businesses, which he's in the laundromat and cleaners business. And he said, look, this has been abandoned for about 5 or 6 years. I try to get other business people to show interest in it. He said, I'm really interested in revitalizing this quarter, not just having my own business, but having other entities there. And he said, I really want something that deals with health, food, and entrepreneurship and economic development. And, of course, that was music to my ear because
Yeah.
we certainly wanted to start looking at having a physical space. We weren't really sure what we wanted to do with that physical space, but I had the long view, because I said, once this pandemic is over, are we just going to go back to square one with so many of those people who were infected and died or were infected as a result of unaddressed or poorly addressed healthcare issues, the chronic diseases, diabetes, hypertension, heart disease, lung disease, kidney disease. I said, well, are we going to go back to that? I said, no, we need to come back to the community with not just a new health center. We need to come back. When I say come back, I actually physically started moving back to Chicago, but I would need to come back with something different, because as well intended as the community health centers are, and some of the other, I would say free clinics out there or health center, there was still something missing. And so as we were doing our research, my team and I, we found out that, of course, it was all these chronic diseases that were unaddressed, but also was missing was what we call the social determinants of health. And for those of you who don't know that, I mean, this is the buzzword, has been the buzzword for a while. Those are all those other things that we used to call competing life priorities that get in the way of people being able to access, good health or taking care of their health, because if you don't have a stable housing situation, if you are experiencing food insecurity, if you can't get transportation, even get to a grocery store. So these are things that people are struggling with from day to day. And we knew that they were not addressed appropriately, which put people in a situation where they were more vulnerable in Black and Brown communities and other communities. So we knew we had to come in with a model that incorporates that, as well as we wanted to look at a new model in terms of the type of modalities that we wanted to offer. And the third piece is how it's going to be offered. So when I talk about modalities, we look at the 4 areas that we decided based on research and data that were most important to be addressed in these communities. 1 is culturally competent primary care. 2 is addictions, because we know that people are already struggling with addictions. And with the social isolation that occurred throughout the pandemic at its heyday, we know that only made it worsen people's addictions, okay? Addictive use. And then that dovetailed into mental health. A lot of people use more because their mental health was impaired. More people became more mentally unstable because of the pandemic. So it was a cycle. And then the last but not least was the nutrition. People were food insecure to start out with. And we had with, certain social unrest, that we had grocery stores, a few grocery stores in our community, dollar stores that were being used, as de facto grocery stores, drug stores. A lot of them closed, left us with a food desert, a healthcare desert, all kinds of deserts, on top of the pre-existing deficiencies in our community. So we wanted to deal with those, but we wanted to not just use what we call conventional model of healthcare, where the primary healthcare model is, one goes to a doctor, a practitioner, and they, do a history, they do a physical exam, they may order tests, they may order x-rays, or refer someone to a specialist. And we wanted to break that model because so many people are so tired of being prescribed medications or being shuttled from one practitioner to another, not really knowing why, not really being told what kind of side effects were going to occur as a result of a certain medication or even therapies that they were going to get. And we wanted to build on a model, going back to the term culturally competent model, where we, knowing how fatigued people are in our community with the system, that we wanted to provide the things that they say are lacking. And that is spending the time with patient. I call primary care not that model, not just that model I just described, but primary care really should start out with listening. Because unless you listen to your patient, if that's not the first thing you do, that means everything else you do after that really is on the wrong path.
Right.
Because you really need to understand where people are coming from, because many of the and mental disorders that they are struggling with come from a space that we need to have an understanding of. Today, making sure that we're spending enough time with our patients, we're listening to them, and we're connecting with where they come from, not just geographically, but their experiences, their life experience. We're tired of practitioners telling them, you know what, you should just eat more fresh fruits and vegetables, when they were living in food deserts. Okay.
Right. So I want to also ask you this, Dr. Shabazz. What's been the community's reaction to the center thus far?
Initially, it was curiosity, excitement, but as well as some doubt, as to what our motives were. I mean, so the curiosity was, wow, something like that in this community, I've heard of these things, but not, things, this is not something we expect would have landed in this community, even though it's economically diverse, but the area, the physical area that we're located in, it was like, it's blighted, it's like, so but then this whole thing about questioning about what our motives were, that kind of surprised me, but not because I'm sure that there were other business or entities that have come there and they were suspicious of it, they weren't sure what their motives were, and so we coming in actually kind of engendered some fear in some of the residents, because they saw not only we were bringing in this health center, we were doing this gut rehab of this building that had been given up for dead, and their thoughts were, what's going on over there, and how does that impact us as a long-term? Does this herald gentrification? Does this herald then now our taxes are going to go up, and now we're not going to be able to afford to stay in the community?
And you mentioned, Dr. Shabazz, about the building. Tell me about what the building was before and what it is now, and that contrast there.
Oh my God. It's a mixed use building, had apartments on the second floor, and there were several retail entities there. One looked like it was a grocery store, the other one selling t-shirts or whatever. There was a currency exchange there. But we were told by some credible sources that they actually were running drugs and guns out of there. So it had been abandoned for about 6 years. In fact, I understand when my godson was trying to acquire it, that they had difficulty even finding out who the owners were. Okay, so it was totally abandoned. And so what happened, they went in after he acquired the building, did a complete gut rehab. Now we have in the space 3,300 square feet is allocated to our health center now. It has 3 exam rooms. We have what we call a multi-purpose room where we do some of our meetings and classes, and we also use it for some of our modalities like deep breathing, meditation, yoga, acupuncture, massage. And then we've just finished what I call a wellness room we use for counseling. We got put beautiful furniture in there. It's
It's a beautiful, beautiful facility. It's gorgeous, state of the art. Everything is there that you could possibly want, and some things you didn't even know that you needed.
Right, absolutely.
It's a totally comprehensive approach that you're doing to integrate all those different facets to meet those different areas that any patient would need, not just a medicinal approach, correct?
Well, I look at everything being
Yeah,
medicinal.
yeah, I appreciate that.
So yes, we're bringing in practitioners who are bringing in different modalities, but they integrate well together.
Absolutely.
Expanding our approaches by not limiting ourselves to Western medicine.
A wellness approach that is comprehensive for the whole person. So what's been the most challenging part, Dr. Shabazz, about this process?
Well, we always talk about money, but no, seriously, it has been money. But sure, the frustrating part about it is that it's getting money that we already allocate through our taxes to be directed towards programs that are much more effective. We had a meeting yesterday with one of the state representatives, and also the head of the Department of Behavioral Health for the state. Well, one of their divisions, and it was painful because the representative gets it. She gets what we're doing, but she does not have control over the purse strings of all of these different departments.
So how are you meeting that hurdle or going over it? What's your approach?
We're coming up on almost 3 years now, okay? And we are people of faith, okay? We started this with nothing but the idea, but we have been blessed throughout this process to do crowdfunding, sustainable donors. More recently, we've been getting more grant dollars. And even with that, if you're a brand new organization, many times these foundations kind of give you teaser grants, okay, I'll see what you do with this. And if you do something good with this, you're accountable for it, then we'll reconsider. But I'm telling you, it's like you're going on a trip to California and you only have a couple of gallons of gas in your tank. Not enough money when you get to the next gas station. So, but we are building momentum. We continue to try to reach out to corporations and people who have connections. And really critical. I mean, some of our supporters are business people. They have vendors that they work with, and we're asking them, hey, ask your vendor, if you're supporting, look, this is an organization that I want to see survive and thrive. And so I do business with you. I do a lot of business with you, so consider, donating. And some of it could be in kind. I mean, we've gotten probably maybe $50,000, which has been huge.
That's huge.
So yes, that as well as just not just, but getting out here in the sphere for potential research dollars. I just got a call yesterday about that. Any way we can get it out, because our goal is not just to take care of patients, which we know is a primary thing. We look at this more as a movement, not just a health center, because once this model is fully matured and running well, we want to be able to help other communities replicate this. In fact, I just got a call yesterday, an organization down in Mississippi looking to open up a wellness center, and we're going to be talking to them how we can help guide them through this process.
And is that part of, because I love that the momentum is spreading, that this is not just the first step in your vision, but one of many. So what is the most rewarding part, Dr. Shabazz, of what you're doing, and what is next?
The most rewarding part, we've had patients or people out in the community. When we do community events and things, I've never heard a single person say that we don't need this. Oh, that's just a lot of, no. They get it, they understand it, they would like to be able to have access to it. And then the number of people from different walks of life in different areas, at different industries who have just gravitated to us. I shared a story last week. I was introduced to several women who are working on violence prevention in the Woodlawn and South Shore area. And one of them is architect, and the other one is a neuroscientist at Northwestern, who also is a violinist in the Chicago Symphony Orchestra. And the third person is a pastor of a church in Hyde Park. They were so excited after we met on Zoom. They said, we want to come over. I said, okay. We now have a healthy restaurant next door. So they said, yeah, we want to come over. And so they came over last Friday, and we talked, we sat down in the wellness room, and I didn't notice that the woman who plays for the Chicago Symphony Orchestra had brought her violin with her. He said, I wanted to come here to play.
Wow.
We walked in that room, she pulled that violin out, and she blew our minds away.
Wow.
It was so soothing. And I recorded it. I did a video recording, and I watched her body language. And like she was inhaling and breathing into the violin. awesome. And the neuroscience work that she's doing is showing the impact that music or certain tones, because they have, how they can break all these tones down, and how they affect
Wow.
people are experiencing PTSD,
Yeah,
Alzheimer's, and epilepsy. It was
that's
also,
incredible.
so these are people who are coming to us and say, look, we
Yeah.
would like to work with you
How
some
can
more.
I help?
That can make this available to people in the community. The woman who was an architect, I'm telling her about my vision of actually building out the entire block, which is to the east of us. You know how we have the long blocks in Chicago and the end block.
Yeah.
So we're in an end block, and we're buying up all of that. Okay, and another block to the east of us. I want that block. We're getting that block. And this woman said, look, I'll help to design it. Okay. So
Mm-hmm.
we have attracted so many like-minded people with so many resources, so many dreams. And I tell my staff all the time that, when we're planning programs, I said, I want you to think about what you have longed for in a health center, in a program like this, and make it a reality. This is your dream, you know? This is your dream. So let's do it. Don't tell me about, I don't know, I don't, no. We're gonna find out how we can do it. So
And
this
you are
new,
doing it.
yeah, we are doing with God's help. And this new block, I want something that's gonna deal with our youth,
Mm-hmm.
preparing for not just jobs, but entrepreneurship. Also, there's an organization called Manchester Bidwell that has their newest site over on the west side of Chicago called TICAP. And they prepare people for living wage jobs. Okay. I want things to do with mental health. I want things to do with homelessness, because we now have little mini homeless camp just 2 blocks away from it. We have to deal with at least, of course, mental health, And one thing is, you talked about the social determinants of health.
Yeah.
Yeah, sure. We need case managers. We need people who can help us to put together what I call a resource directory network, which would not only give us information about social service agencies and other agencies that people are looking for resources from, but also we want to use this as a way of tracking whether or not people are actually getting those services. And there actually is an app that was developed by a University of Chicago physician that would be extremely helpful with that. But the one thing I'm really seeing now so much help in, is huge, is a case and care management program, because I have been inundated with requests for people who are feeling like they've been cut off from the healthcare system, that they're not getting the care, that they're not getting into the doctor's offices, they're not getting into the emergency room. People are telling me that they're spending 10 and 15 hours in an emergency room with family members who are clearly sick and be admitted. And then some who are saying, well, even after they're admitted, they're still on gurneys sitting in the emergency room. So this is a heinous crime. I have a friend who was diagnosed with several months ago with stage 4 cancer. And it took a month or so to get him in to see the oncologist to start the therapy. A month. I was like, are you kidding?
That's unacceptable. Unacceptable.
Unacceptable. But nobody's saying anything about this.
But you're not only saying it, but you're changing it, This is a big change.
Oh, yeah. Yeah.
So let me ask you this. What can people who are listening or watching, what can they do to help you? What can they do to further your mission and your vision?
So trust doing is legitimate. Go to our website, Salaam, SALAAMCWC.org, and check us out. That's legitimate. Come to our health center if you're in Chicago area. We'd love to show it off and talk to you about what we're doing and find out how you can help. Yes, financial help is one thing, but as we talked about earlier, you may know someone who has a lot more money or influence or resources than you do, and that individual may be someone who's willing to help us. We continue to to attract good practitioners who are interested in becoming a part of our team. We certainly want to go after funding for our build out. I think we've estimated it's probably not going to cost anymore between $20,000 and $50,000. But our biggest expense, as with any organization, save one that is a free clinic where you have volunteers, is our staffing. We have to get secure staffing, or else we're not going to be able to provide the services when people need it. I'm not sure if you heard about this, but South Suburban Hospital is changing to a mental health focused hospital, and they're not going to be doing OB services there.
Oh, wow.
They're going to be taking women over to Rice Hospital, which is a good distance. And they said, oh, no, we're going to take care of them. We're going to have transportation. But let me tell you, what we were also told is that the transportation that they are arranging for these women is only available during regular business hours. So if you're a pregnant woman, you go into labor, you can't wait until
you cannot.
Okay.
No.
And sad to say, that's a highly or densely populated area for African Americans,
sure,
Latinos, and that the statistics have shown for a while now that Black women have the highest maternal mortality rate.
Yes.
And we have the highest infant mortality rate. And many of the conditions that contribute to that are things you can't for a transport, miles away. These are things in which are life and death issues, conditions that, during pregnancy and labor and delivery, you don't want to play with. I would encourage your listeners who would like to find out more about that. Linda Villarosa, who was the health editor of Essence Magazine, just wrote and published a wonderful book, heartbreaking, but she's on it, talking about the maternal deaths and the conditions of racism contribute to that. When we're pushing for changes in policies.
And that we need. And we have time for maybe one more question, Dr. Shabazz. Is there anything that we didn't cover that you think would be especially helpful for people to know about you, about the center, what makes it different perhaps, and why this is something that is not, as you say, just a center, but a movement?
It's a movement because of the momentum, not from within, but from outside. Our society really does not have a true health system. I used to teach the fundamentals of healthcare at Davis University. And that was one of the first things that my professor there told us. It's not a true system. We have all of these individual businesses. They sometimes communicate with each other, a lot of times no. And so we really need to develop a true system in this country. And it's not just a payer system, but a communication system, coming up with standards that we're held accountable to. We shouldn't have people running all over the place, trying to manage their own care when they don't know what it is they need oftentimes. So that's one major area that I see us helping to develop with this movement, out of the needs and desires and disappointments of people, that we are that as the momentum, because it's not us saying, oh, I think you need it. It's all recognizing that we all need it. And so that is giving a lot of leverage to have these conversations with different people about supporting this. Because, we can talk about education. Some people say, oh, no, I don't have any kids in school, so I don't want my tax dollars to go there. There's not a single person who is alive and wants to stay alive and who does not need health care. So that's where we're coming from. And I hope I answered your question.
You answered that question and so much more. I'm so delighted that you were able to join us. I am so grateful for what you're doing. I've had an opportunity to see it. I highly recommend to go, to come, to visit, to share it with your friends. It is an incredible, beautiful center, but it's also an incredibly important mission. And as Dr. Shabazz said, movement. So please be a part of it. Check out her website. Please visit and please tell others about it. Thank you so much, Dr. Shabazz.
And just in closing, share our address. Our physical address is 618 Our physical address is 613 East 67th Street in Chicago, Illinois, 60637. If you want to call us, 773-435-9493.
And that is where we will end. Thank you so much.
No, thank you.